What does a typical pelvic floor physical therapy appointment look like? What are you going to do to me? Hi, welcome to our Ed Talks, little snippets of education to help you heal and feel empowered. I'm Justine Calderwood, pelvic floor physical therapist and certified birth healing practitioner. I'm going to talk to you today about what a typical session looks like in my treatment room. So I'm speaking basically for us here at the Healing Spot, myself in particular. So, this is something I get asked a lot when I do consultations, when I do a discovery session with people that are coming in and want to know how can I help them. And we talk about their specific, say, diagnosis and their symptoms and all of that. And eventually it gets around to what are you going to do, Justine? What does this look like? Because I know there's a lot of anxiety, there's a lot of questions from women that are coming in for care on what exactly are you going to do to me? And I don't want there to be a lot of anxiety because really it's just about the unknown, right? So today we're going to clear up. I'm going to explain to you what a typical session looks like. I'm going to talk about more like the first one or two sessions, okay? So if you're coming in for a session, we're going to start with an assessment. I want to get some baseline information about how your body is currently balanced, how you're moving, any areas of your body that say aren't moving well. We're going to check your strength. We're going to do some assessment things that I know as a physical therapist help me to help you. So, what does that look like? For one, I want to say, even if you're having pelvic floor symptoms, like maybe you have incontinence or prolapse or diastasis or, pain, something's bringing you in for a consultation, for an assessment. I want to tell you that I'm going to look at you more than just your pelvis. Okay. So I'm going to look at you as a whole person because a lot of other things about your body help to give me information about what might be going on for your pelvic floor as well and what's causing some of the symptoms that you're experiencing. So, what we'll do is we'll start with you in a standing position. I like to get out my models and explain what I'm looking at, what I'm seeing based on what's in front of me and what I'm seeing in your body. So, I might get out my spine model like this. With you standing, I'd like to watch and look what's going on in your body, your posture, how you move from a front view, from a side view, and also from a rear view. So I can see, are your hips level? Okay. What's going on here at the bony structure that again is going to tell me a lot about the hip muscles, your abdomen, your glute muscles, and the pelvic floor muscles. So I get out a lot of my models and explain what I'm seeing, what I'm feeling, and why that's important in relation to the symptoms that you're experiencing. The other thing that a pelvic floor physical therapy session might involve is internal pelvic floor assessment and treatment. So let me explain that because I think that's probably the one thing that people are the most afraid of, oh my gosh, I'm going in for a pelvic issue and she's going to go right in and check out my pelvic floor and I'm not ready for that. So I want to explain one, on a first assessment, like at the first visit, I rarely do a pelvic floor assessment. Okay. Unless there's a really big need for it, I tend to want to use that first session by looking at the external things, lower abdomen, hips, what I can touch externally and look at externally, because I feel like that builds rapport and builds just trust between the two of us. I want you to know that I'm a safe person to be around and to treat you. And so I think building up that trust first and that sense of safety is very, very important. So when and if it's indicated, I might talk to you about doing an internal pelvic floor assessment. So I want to go over more of the details on that. And after I explain some of the anatomy, then I'm going to actually show you or describe to you what that actually looks like in my treatment room. So again, I love to use visuals, models, so you can understand the anatomy before we even get started. So I would get out my pelvic model here and explain to you about the organs, the bladder, uterus, rectum. Of course, I'm looking at a female pelvis here. I want to clarify that. But I would talk to you about where the organs are, and in relation to what I was seeing external in this bony structure in through here in the pelvis and the lower back. And then we would talk about the pelvic floor muscles, and I would explain to you, how they are situated here in this pelvis and from the deep pelvic floor muscles to the more superficial muscles closer to the surface of the skin, and go over those anatomy points with you so you have an idea of what to expect. Then I have you sign a consent form because I need your consent. I want you to understand what you're consenting to and answer any questions that you have prior to even beginning. So a couple other things I wanted to mention with that is this is the room that I use here at the Healing Spot for my treatment sessions. I have a nice soft bed. I actually have like a memory foam mattress on a massage table. So it's nice and soft. Okay. So if you are experiencing pain of any kind, you're going to feel nice and supported. I have a private room, and right outside of my room, I have a sound machine. So anybody that's walking by or front desk, people in the waiting room that are here for other appointments, they can't hear what you're telling me. Everything that you share with me is confidential. We're going to keep it here in the treatment room. And then as far as the actual setup for a pelvic floor assessment, you can see I have a pillow here, and I don't have, the plastic sheet or whatever they use at the gynecologist. It's very comfortable. I have a regular sheet. And then what I do is I just put a little towel underneath your bottom. We keep you draped, okay, with a nice big comfy sheet over top of you. And I don't have stirrups, so we use pillows on either side of your hips to support your body. Okay, so it's very, very comfortable, much more comfortable than going to the gynecologist. The other thing that I just want to say is everything that I do as a therapist, I've actually also received this type of treatment because that's the only way that I was able to learn it is to be a patient as well as therapist. So for every single technique that I've ever learned, I've had to experience as a patient in a class, in addition to practicing on my lab partner. And for me, that has really helped me to understand the vulnerability, the anxiety, and the fear that you may be experiencing as well. And I always come from the space of keeping you safe, making you feel supported, comfortable, and respecting you at all times, asking for consent and explaining what I'm going to do, not moving suddenly. Trust me, I'm a woman as well that has had less than, I guess, pleasant experiences at the gynecologist. So trust me when I say that I'm going to respect you at all times. And the other thing I want to say with that is my number one rule with any of my patients is you are in control of your body. If you ever need me to stop for any reason, or if you need me to ease up pressure, if I'm putting pressure through my finger and you need me to ease up my pressure, you just need to speak up and let me know that. And I will 100% of the time respect that and do what you're telling me to do. Okay. So hopefully that alleviated some of your stress or questions about the unknown. If you have some pelvic floor or core concerns, please reach out to us here at the Healing Spot. We would love to answer any questions that you have and get you booked in for a discovery session, a consultation, and we can sit down face to face and answer any questions that you have that are still lingering. You can head to our website, healingspotpt.com, and choose whatever option works for you. Thank you for watching this Ed Talk. I will catch you on the next one.